It is so amazing to see so many people here today in support of our dysautonomia community. This event is called Unity in Community, and boy oh boy, did community show up. I want to thank you all, and I want to do a huge shout out to Pie & Burger for donating 100% of sales, which is just absolutely amazing. And thank you so much to our event sponsors. Thank you to our incredible volunteers, and to each and every one of you who are here today showing up for people impacted by dysautonomia. I'm so, so very grateful. I so wish that I could go back in time to 15-year-old me, on bed rest or stuck in a doctor's office, too sick to go to school, and so very, very lonely, and show her just what a supportive community I would one day have. More than that, I wish I could go back to show my parents, my lovely mom and dad who protected me and faced the challenges, the isolation, and the scary unknowns of their child's illness on their own. I hope that many people here today facing the trials of dysautonomia can look around and know that they are not alone. Dysautonomia is an incredibly isolating illness for a variety of reasons. First off, not many people know about it. Even many doctors don't, and even those who do know about it don't yet have an adequate understanding of this complicated illness. Dysautonomia patients and their loved ones are very often left to search for answers alone. Thank you very much, Toby. Appreciate it. Dysautonomia is isolating too by its very nature. It is exhausting. Fatigue is already a common symptom, and it takes so much time and energy to try to be well on top of everyday life obligations. And dysautonomia is rarely simple. Most people face a large variety of symptoms requiring care from multiple healthcare professionals. Many people are forced to spend their precious energy in doctors' offices, sometimes across the state, sometimes across the country. Many people are forced to stay home, to rest when they'd rather be socializing, working, living their lives. They become isolated. LADN was formed to combat this isolation. In early 2018, Emily put out the call on Facebook asking if anyone wanted to meet up and start a support group. Many of us answered, and we've been meeting monthly ever since. In 2020, a few of us decided to expand beyond the support group and formed Los Angeles Dysautonomia Network. We added community building events, guest speakers, and wellness workshops. It has been a little over a year now since LADN became a nonprofit organization, and what a year it has been. Thanks to the success of last year's inaugural fundraiser, thanks to so many of you, we started a grant program to help dysautonomia patients afford medical care. We increased our educational offerings, hosting workshops on disability employment law, meditation, psychology, and more. We began a sick-lit book club to see our chronic illness and disability experiences represented in literature. We grew our membership by 68%. We now serve over 225 dysautonomia patients and caregivers. Thank you. It's always a funny thing to learn someone has dysautonomia. Typically, we're like, "You have dysautonomia too? Yay!" Then we're like, "Oh, sorry, you have this terrible, terrible illness, but let's be friends." There is nothing quite like the understanding shared by people who have gone through similar experiences. It's a balm to the soul and a weight off one's shoulders. So this huge growth in LADN's membership this past year is in part due to the fact that an estimated 79% of people with long COVID have dysautonomia. That suggests that around 1.2 million Californians have dysautonomia from long COVID alone. So it's a huge amount of people. LADN's work and the support of our wider community is more vital now than ever. So thank you all for being here. There are so many people facing the hard realities of dysautonomia today. Too many of them feel alone and daunted by the complexities of this illness. That's where community comes in. Together we can support each other. Together we can gather resources and learn from each other. LADN's recommendation lists for healthcare providers and health aides are our most requested item. Together as a community, we put our heads and our hearts together and come up with solutions and support to make the challenges of dysautonomia surmountable. We did a big annual survey at the start of the year, and we were so pleased to discover that the majority of respondents said that LADN helped them feel more connected to an understanding community, improved their ability to cope with the symptoms of dysautonomia, and equipped them with resources to improve their quality of life. Community is and always will be at the heart of LADN. No one should have to face this illness alone, and there is so much strength and beauty and joy to be found in the collective power of community. So thank you all for being here today. We hope you'll consider yourselves a part of the LADN community for many years to come. Thank you.
I'm so glad to be here today. My name is Lori Wynstock, and I'm an internist quite close to here. I'm from the Keck School of Medicine and graduated, thank you very much, in the mid-1990s. And I just want to say that I don't recall learning anything about dysautonomia in medical school. We certainly had plenty of neurology rotations, and yet I don't remember it being mentioned. During my residency, when I think back, I believe I had many patients that had dysautonomia, and I recall we would work them up ad nauseum, come up with lots of different things to say to them. And I don't remember dysautonomia really being broached as an entity. I remember one of my patients in particular, a young woman named Amy, that I admitted twice as a resident. She was 22 years old from the Arts Center, a student. And I admitted her because she kept passing out. And she had a whole cardiology workup. She had a huge neurology workup. And basically what we told her is drink more water, eat more salt. And that was no diagnosis for poor Amy, who couldn't finish college and went home to her parents on the East Coast. So what is dysautonomia? Our nervous system can be thought of as having two aspects to it. The somatic nervous system, which is under our voluntary control, and the autonomic nervous system, which regulates bodily functions that occur automatically. These are things like our blood pressure, our heart rate, constriction of our blood vessels, relaxation of our blood vessels, our digestion, many of the processes that go on in our brains, and that's just a few of them. So dysautonomia occurs when this regulatory system goes awry. As you might expect, this can lead to low blood pressure, high blood pressure, a fast heart rate, a very slow heart rate, fainting or near fainting, brain fog, all sorts of digestive disorders, and many other things. These autonomic dysfunctions can be abnormal for a variety of reasons, and often the diagnosis of dysautonomia is really not entertained, or it takes years to get to that conclusion. I am so proud to be a member of the Los Angeles Dysautonomia Network, and what I hope for the future is that this varied and oh so incredibly complex syndrome can be brought to the consciousness of the public as well as to us healthcare professionals. Thank you.
All right. Hi, everyone. My name is Sarah Skolnik, and I first want to invite all of you to look around the room. Most of the people here don't look sick, but just because someone doesn't look sick doesn't mean they aren't. The reality is a lot of people here have invisible illnesses that are debilitating, but not always visible from the outside. I like to explain it to people with the iceberg analogy. The top of the iceberg is visible and obvious, and underneath the waterline, there's a lot of debilitating symptoms like pain, brain fog, and fatigue. And these symptoms are often undetectable and it's very important to advocate for others with disabilities, the ones we see and the ones we don't see. I was diagnosed with dysautonomia in 2020, specifically POTS, postural orthostatic tachycardia syndrome. At first, I was in denial, But I learned the hard way that acceptance is a huge part of managing chronic illness. Dysautonomia, though not so rare because now millions of it have it with COVID, is a rarely specialized medical profession, and with only a few board-certified autonomic specialists, no wonder why a diagnosis can take an eternity. Dysautonomia affects everyone so differently, and I can only speak to my own experience when I say that healing is not linear. Although I stand here today, 4 years ago, chronic illness turned my life upside down, quite literally. From debilitating dizziness to body weakness, breathing issues, temperature dysregulation, heart rate irregularities, these symptoms that would rightly scare the average person became very routine, such as combing one's hair. After traveling out of state, seeing numerous specialists, some that were helpful and some that weren't, my doctors were able to determine that I had a virally, possibly COVID-induced autoimmune condition called Lambert-Eaton myasthenic syndrome, and that activated the dysautonomia and my POTS. Like many of us here today, I wake up each day trying to juggle my symptoms. The other terrifying reality of chronic illness is that it hits you right where it hurts. I think LADN members can collectively agree that chronic illness changes us and tears away at our independence. In 2020, of course I'm getting emotional already, I was a previously healthy 30-year-old woman. Coincidentally, I worked in healthcare philanthropy, and for many years, almost overnight, I was basically bedbound. I was forced to give up my career, my passions, and most importantly, my independence. Independence is something you don't take for granted unless it's ripped out from underneath you. Independence to drive, independence to do basic daily tasks of living, independence to live a simple life that doesn't involve symptom tracking, insurance, doctor's appointments, managing claims. One thing I desperately searched for was a community that just understood. It can be incredibly difficult for people who do not experience chronic illness to understand the desperation of not just wanting, but needing emotional support. As they say, you don't get it until it happens to you. Around the time that I first fell ill, I learned about the Los Angeles Dysautonomia Network. It was evident that LDN provided a home away from home where members can create amazing friendships and help lift each other up during the hard times. I'm very lucky and very grateful to have support of my friends and family, some of which who are here today, so thank you. But I do realize that not everyone is so fortunate to have such an amazing support system, and that's just one way that LADN can come in for so many. I am so incredibly grateful for the support from LADN, and I want to thank them for being a ray of sunshine on my darkest days. When I found out that I was one of 12 2023 grant recipients, pure joy was one of the biggest emotions that came upon me. What people don't realize is it's really expensive to be sick. Due to this immense hardship this illness has brought, financial assistance that I was so fortunate to receive helped pay for my off-label medications, co-payments, medical equipment that helps aid in my recovery, so that I'm very grateful for. And the wonderful thing about LADN's grant program is that it allows for individuals with chronic illness to utilize their grant for inclusive and expansive treatment. I would like to thank all who have donated towards the LADN grant program. Your donations have had an enormous impact on myself, and I'm sure for others. I would also like to thank the co-founders of LADN, Emily and Sally, for this opportunity to speak and shine a light on all the hard work they do to support their members. We are so positively impacted by the amazingness that this organization emits, and we are truly looking forward to the enormous impact it will continue to provide for the Los Angeles Dysautonomia community. I'll end with a quote that I truly take to heart. The opposite of negativity isn't positivity, it's purpose. We don't always feel positive because we aren't meant to. But seeking that which gives you purpose, that will sustain you. Even when the light is dim and you feel lost, you'll find your way again. Thank you.
That was a tremendous testimonial. Can we give another round of applause to Sarah for sharing her story? My goodness. Well, I am so thrilled to be here once again. It was last year that I went to your first fundraiser, and I am amazed by how much you've grown since then. So, can we give a huge round of applause also to our co-presidents, Emily Suñez and Sally Krueger-Wyman? They've worked really hard to make this a viable network. And every time I come here, I'm struck by how much this network is needed. When you have these kind of debilitating conditions, you need friends that you can reach out to. But with this organization, now there is the concrete help with these grants. So I really want to thank the LA Dysautonomia Network for all that you've done to help so many people in this community. It's incredible that you only began as a support group in 2018. Now you're a registered nonprofit organization, and now you have this whole community of people from all across LA County. You should be so proud of what you've been able to build. Now, with events like this, we know you're making a difference. There are more than 100 autoimmune diseases impacting 50 million Americans every day. And of those affected, 75% are women. And we are also witnessing the growing connection between dysautonomia and long COVID. About 75% of long COVID patients have dysautonomia. And so it's hard to find anybody who hasn't been touched by it in some way, directly or indirectly. And in fact, just last year, I met with a constituent from Pasadena in Washington, D.C., named Beverly. But when she told her story, I thought about all of you. She suffers from chronic illness due to chronic fatigue syndrome and complications of it. Like all mothers, she'd hoped that her daughter would grow up and have a chance to pursue her dreams, and she did. She was able to work hard. Well, Beverly herself was able to work hard and become an assistant managing marketer at a large international corporation. But her life came to a full stop as she became sicker and sicker from unexplained symptoms and chronic pain. And due to the severity of her chronic illness, basic tasks that were once routine, such as working at a computer or driving a car, became incredibly challenging and painful. She visited dozens of doctors at 10 hospitals across the country and finally was diagnosed with dysautonomia, but after suffering for more than 16 years. So we need to get the education out and the awareness out sooner than that is for sure, so people can get an answer as to what is going on with them. So I want you to know that in Washington, D.C., I'm fighting in Congress for resources to raise awareness or find cures for dysautonomia. Yes, thank you. And it comes with what goes on with the National Institutes of Health, or NIH. Of course, I always support increasing funding for the groundbreaking medical research that can hopefully turn autoimmune diseases from terrifying mysteries into treatable and even curable diseases one day. And so I'm thrilled that last month, President Biden did sign an executive order that will invest $100 million into women's health research to address the research gaps for conditions that predominantly affect women, including autoimmune diseases. Yeah. So I truly believe help is on the way, and I am a co-sponsor of the Treat Long COVID Act, which would provide federal funding for the creation and expansion of long COVID clinics and provide grant funding to help advance long COVID treatments and cures. But the core of it is all of you, helping one another and sending that message that those with dysautonomia are not alone. So I want to thank you for joining together, for being here, for all your support and your incredible collaboration and networking. And I would like to present certificates of congressional recognition for this event for our two co-presidents, Sally Krueger-Wyman and Emily Suñez. Thank you for everything that you are doing.
When I was asked to speak at this event today, if I would say a few words about my experience with dysautonomia, I thought back to when I got my tilt table test in 2021. After years of doctors telling me there was nothing wrong with me, that something was wrong with me but they didn't know what it is, or that they knew what it was but they just couldn't treat it, I felt vindicated to actually have a doctor tell me that yes, indeed, I did have POTS. I was still a little bit nervous, though, and I remember asking the nurse, "So, you have all the data, right? You can prove that I actually am sick." And he said, "Yeah. In fact, we actually kind of knew that something was wrong even before we looked at the machines. We could tell that something was seriously wrong with you, that you were about to faint because something seemed off." I said, "Oh, what was that?" And he said, "You stopped talking." This has become a joke with my friends and family. When I stop talking, there is seriously something wrong. He explained to me that quiet patients tended to start talking to themselves when they were near syncope, and talkative patients tended to get quiet. I am very much the latter. I first started fainting in 2014. At first, it was times when I was dehydrated, when I had migraines, when I was living in New York City and the weather changed drastically, which it did a lot there. It soon became a regular thing. In fact, a lot of my friends have funny Mara fainting stories now. "Oh yeah, remember that time that Mara fainted and we had to take her to the hospital and she was in the wheelchair and they said, 'Okay, we're going to the left,' and she started singing Beyonce's Irreplaceable. To the left, to the left." I also actually have a list of places that I've fainted or have nearly fainted. Good places to faint, bad places to faint. It's become a running joke. But in 2017, I contracted a routine summer virus, which destroyed my already fragile autonomic system. Suddenly, I was exhausted all the time, I was weak, I was in terrible pain, and my fainting episodes were preceded by the worst feeling that I have ever felt. I often describe it as a feeling like you are walking down a dark alleyway by yourself late at night after drinking a triple espresso, after somebody has dosed you with some kind of psychoactive drug, and you hear footsteps behind you and see coyotes in front of you. Yes, I know we live in LA, coyotes aren't that scary anymore, but it's still pretty scary in context. I was completely miserable, and the cardiologists, rheumatologists, and endocrinologists that I saw didn't have any answers. It was community that saved me. I think I posted on Twitter once about fainting and immediately got all these responses saying, "Hey, do you have dysautonomia? And join the POTS Club. We have salty snacks." But it wasn't until I watched a YouTuber's video about having Ehlers-Danlos syndrome and POTS that I realized that this might actually be what I had. I contacted her. Fortunately, she followed me on social media, and she sent me to some wonderful resources. I don't have EDS, but I did learn very quickly that POTS and dysautonomia are comorbid with conditions I do have, such as endometriosis. I have also learned that POTS can develop or be worsened by viruses. I was able to research doctors who were able to help, which is how I was able to finally get a tilt table test and a diagnosis right here in Pasadena in 2021. After I started being open about my diagnosis, something strange and wonderful happened. People started reaching out to me for help. They would say, "Hey, Mara, I've been fainting ever since I had COVID. Hey, Mara, I heard about POTS. I think I might have it too. Hey, Mara, something strange is happening to me. Do you have any advice?" And I did. I had lots of advice. I had things that helped me. I had names of doctors, and I have been able to help several friends because of it. This, I think, is why LA Dysautonomia Network is so incredibly powerful and so incredibly necessary. Today, I'm paying it forward because I know that I would not be able to stand up here in my compression socks, which, as you will notice, are teal, the color that we are all wearing today, and also covered with cats because that's who I am. I'm a cat lady at heart. But the important thing about LADN is that it provides community and support and resources. and that is exactly what we need. I am so grateful for that. I am so grateful to them for all they have done, and I promise you, I am not going to stop talking. Thank you.
I don't know how to follow all that. I mean, Sarah, thank you for sharing your story. Emily and Sally, thank you for last year reaching out. I'm one of those that never heard of this. And it's because of your reaching out and educating me that our office stepped forward and sponsored last year. And of course, I want to thank your mom and dad for opening up their home. Where are they? Yeah, right there. Thank you. And I have to tell you that I know, I think our representative is left, but I will say this. It's because of your education that provided her with the knowledge to go back to D.C. And when you hear about COVID and the impact that COVID's having on women especially, and the long-term COVID, that is a result of you all helping us do our jobs. So I want to thank you for that. I want you to know that this is something that I take to heart. Last year, I heard you doubled in size, maybe 250 people this year. It tells me that this is impacting far more people than we know. And there are many out there that are suffering that don't know what is wrong with them. And I can only imagine the frustration of not knowing, knowing something is wrong, but not being able to get a diagnosis. So, doctor, thank you for your commitment to educating the medical community as well. Because I think that, it resonates with me because my sister-in-law had Lyme disease for 15 years. And she was diagnosed with chronic fatigue syndrome, with mononucleosis, and then people just thought she was just hypochondriac. And in the end, it turns out she had Lyme, and it changed her life. So I can appreciate the need to better educate the medical community about the symptoms and what can be done. So I just want to acknowledge you all, and on behalf of the County of Los Angeles, provide a commendation to LADN for the work that you're doing and the grants that you're giving. And Sarah, when I hear that, it makes me want to figure out how to give you more, because that is what it's all about, is allowing you to get your independence back, at least to a level that you can live the quality of life that I know that you deserve and want to live. So with that, on behalf of the County of Los Angeles, I want to present this to you both. Thank you.
Hi. As a parent, one of the most painful experiences is the suffering of one's child. When my child at the age of 10 started suffering physically and emotionally, her world getting smaller and smaller as symptoms flared and more things were too hard, I was desperate. I wanted answers, I wanted solutions, I wanted help, I wanted support. What was going on? This stellar student couldn't go to school. Going to restaurants was impossible. We went to Target and had to leave when she turned sheet white and felt horrible. Despite many of the physical symptoms being associated with anxiety, as a child therapist, I knew this was not run-of-the-mill anxiety. This was different. This was so sudden and so severe and out of the blue. I knew there was something else going on. It was as if someone hijacked my child's body, stole her joy, her laugh, her ease, and replaced it with a host of physical symptoms, confusing symptoms that fluctuated over time. Regular life came to a screeching halt. Everything revolved around how she was feeling. It had to. Early on, we tried to push her and regret it. As the flare intensified, we contradicted what good parents do, like send your child to school, and had to pivot to be the parents that she needed before we even knew what was going on or why. Invisible illnesses carry the burden of disbelief and the judgment of those who, of course, can't see what's wrong. She lost friends. We were shunned by our school community. That's why finding LADN, and in fact, this event a year ago was the first time we participated. Finding LADN was a community, a place to land. My daughter knew no one else with the challenges that she faced. It was affirming. Like everyone with dysautonomia can attest, landing a diagnosis is a lengthy process of dead ends and finding solutions even harder. Currently, there are only 56 board-certified physicians in autonomic medicine in the entire country. I'm optimistic that Representative Judy Chu will continue to support the funding efforts in the upcoming and current budget to increase that capacity because it's a desperate need. We were fortunate to work with a dysautonomia-informed physician relatively early on, which was a huge game changer. He mentioned the term, and if he hadn't, we'd still be floundering, frustrated, afraid. I had never heard of this term, dysautonomia, but I researched, read, watched webinars, scheduled tests, all of the above, just trying to learn about triggers and management. Looking back, there were signs when she was 13 days old. That's a whole nother story, but this is the 4-minute version, not the 40. And at age 5, there was a subtle flare that was also misunderstood. It wasn't until the 3rd and most debilitating flare that we received diagnosis, found strategies, and life started to resume some sort of normalcy. Today, life still looks very different than it did 2 years ago. We have an awareness and a toolbox. Symptoms are way down thanks to some out-of-the-box, off-label medication and traveling out of state to receive effective intensive treatment. We drive to San Diego every week so she can attend the only public or private school that can accommodate her needs. She is thriving there, and we are so grateful. And yet, this is not an accessible solution for many families, nor is it easy for us. Knowledge is so key in this discovery process. That's why LADN's efforts to raise awareness is so important. As more people, more medical professionals, more individuals are aware of this, less people suffer alone and confused. So thank you, LADN. Thank you, Emily and Sally and the board and everyone here today for your support. It warms my heart. Nothing makes a mama happier than the support of her child. Thank you.
All right, hello everyone. I'm so thrilled to see so many people here today. As Toby mentioned, my name is Emily, and I'm one of the co-founders and co-directors of LADN. First off, I just need to give a shout out to my incredible support system for being with me at this event today. My husband, Frank, thank you for being my personal cheerleader and always being by my side through this roller coaster that is life with POTS. And to my wonderful parents who came all the way from Virginia to be here. I feel like I won the lottery having been born into such a loving family. You two have been my constant source of support my entire life, but especially through these years of health challenges. Love you. I'm so grateful to all our wonderful speakers for voicing their support of LADN and having the courage to share their personal experiences with this difficult and misunderstood condition. To give you a little bit of background on my story, I was diagnosed with POTS in 2017 after searching for a diagnosis for many years. I battled years of debilitating symptoms that upended my life and my career. I spent years mostly homebound and reluctantly gave up my career as an elementary school teacher. In 2018, LADN's support group began. For the first time, I started to feel like I wasn't facing this illness alone anymore. I had a community of people who understood the challenges I was facing, who provided me with endless resources for coping and managing my symptoms. While I still face challenges with my symptoms, I've made huge progress with managing my dysautonomia. Over a decade has passed since I had to give up my teaching career, And I'm proud to say that I've made a return to part-time teaching in the past few months. And that's thanks in part to LADN, which has made a measurable and profound impact on my life. And I'm incredibly grateful to every member of this organization for being a part in helping improve my quality of life. But I consider myself one of the lucky ones who has seen some improvement. However, many members of the LADN community continue to face ongoing or even worsening symptoms. 57% of our members report that they are too sick to work at all. And a whopping 78% of our members report that dysautonomia has caused moderate or severe financial hardship. What does one do when faced with a disabling illness and endless medical expenses? LADN is working to address this need. One of LADN's big milestones this past year was launching our grant program in the fall of 2023, a program which helps low-income patients with dysautonomia-related medical expenses. In December, we distributed a total of $6,000 in grant funds to 12 individual grant recipients. While we are thrilled to launch our grant program, we fell far short of addressing the total financial need of all of our applicants, which was a total demonstrated need of over $144,000 in medical expenses between our 22 applicants. As such, one of our goals here at LADN is to increase the amount of funding allocated to our grant program. We're striving to make an impact on the financial strain facing this patient community, and we need your help to address this gigantic need. We're fundraising here today to help to create a sustainable future for LADN. This means hiring a staff to support the growing patient community that LADN serves. As our organization grows, so do the demands of our programming. And while we've always been a volunteer-run organization, hiring a staff is crucial to sustaining the patient support that we have as our numbers grow. LADN also has future goals of hosting a patient conference, developing partnerships with doctors across the state, offering multiple support groups a month, and providing care packages to those homebound by dysautonomia. What will it take to allow LADN to accomplish these goals? You got it, funding. We are incredibly touched and thankful for your donations, your auction bids, your ticket, necklace, and burger purchases today. Every dollar raised goes towards supporting LADN and makes an impact in the lives of our patient community. The name of our event today, Unity in Community, is about the core of the work that LADN does, uniting as a community to help support patients in need. By being here today, you've shown your support to those battling tremendous hardship and health challenges. Even after today's event, we want to try to keep the spirit of unity and community alive. So there are lots of ways that you can continue to support LADN after you leave today. Sign up for our email list, set up a recurring monthly donation, sign up to volunteer, attend our community building events, share our dysautonomia awareness video, take our brochures to your local doctor's offices, or even just follow us on social media. It all makes a difference. Thank you so much for being part of our Unity and Community event. We're so incredibly grateful for all of your support. Thank you.